Hello, everyone. Once again, my name is Rani, and I have the pleasure of being your host for this special session entitled A Future in Dermatology, presented by Dr. Collins. Dr. Kristina Collins is a Harvard trained dermatologist and surgeon who specializes in most micrographic surgery, surgical, and cosmetic dermatology. Dr. Collins is also the co founder and CEO of the dermatology practice, Austin Skin in Texas. Let's give a warm welcome to Dr. Collins.
Okay. Thanks so much for inviting me to come talk to y'all today. Are you guys able to see this okay?
Yes, we see it, Dr. Collins.
Okay, great. I had an alert on there that sharing is possible. Okay, excellent. Greetings from Austin. I just wrapped up clinic here in Austin, Texas. This is a picture of me and my team. I'm super excited to tell you guys a little bit about dermatology. And here's some photos from my Austin location office. As they mentioned, I'm a co-founder and CEO of Austin Skin, which is a boutique dermatology practice in Austin, Texas. And we also have a rural location practice in Smithville, Texas.
I apologize, Dr. Collins. We see your slide and not the photo.
You don't see my screen.
Yes, we see the slide.
The slide meaning you just see the first slide?
Correct. A future in dermatology.
So mine's advancing, but let's see. Bring your shared window to the front. Let me see if I can fix it. 1 second. Okay. So if I start sharing it, let's see. How is it now?
Yes, we see it.
Okay, great. Awesome. Okay, so these are some photos from my practice at Austin Skin. Before that, I showed a picture of my team. And like I said, we have a boutique dermatology practice that has an Austin location as well as a rural location in Smithville, Texas. And I co-founded this practice with one of my best friends from residency, Dr. Sarah G, which is sort of a dream come true, right? You make these great friends throughout your training, and then to have the opportunity to open a practice together has been really, really wonderful. And more good news, our other best friend from residency, who's been still with the Harvard system this whole time, is actually moving to Austin next month to join our practice. So we're really pumped to all be together. And I'm excited to tell you a little bit about how I got here. I have some tips that I'll share with you along the way of talking about my path in terms of tips for success in the application process. I'm going to tell you a little bit about types of careers you might find in dermatology. And of course, because I'm a procedural or surgical dermatologist, I'd like to tell you a little bit about a day in the life of a procedural dermatologist and get y'all excited about that. And because I want to share something really special, I'll give you my top secrets to life and happiness. So stay tuned for that. They're ultra top secret. And before we go any farther, remember to stay in touch with me on Instagram at Dr. Kristina Collins. If you guys have any more questions, you just want to stay in touch, that's a great way to do it. So the first tip that I have is one that's probably on a lot of y'all's minds as pre-health students. And it's all about the time, right? How much time is everything going to take? And I'm just here to say, let go of that fear of time. Your time is going to continue on for every person. And no matter whether you're in your health training or you're doing something maybe you don't totally want to do, someday you're going to be 34 and you're either going to be done with your residency or you're going to be doing something totally different. So I can tell you it all happens in the blink of an eye. It almost goes faster than you want it to. So don't worry about the time. Life is short, but it's also really long in a way if you're kind of stuck doing something you don't want to do. So never let that fear of time be the thing that stops you from accomplishing your dream. So in general, the pathway to becoming a dermatologist, you go to college, You go to medical school, you do an internship year, and then you do a 3-year residency in dermatology, and then you have the option of doing a fellowship. The vast majority of people do not do a fellowship, but we'll talk to you about what kind of fellowships are available if you were so inclined. So for me, I started out, I grew up in Phoenix and I went to college at Arizona State. I think my first kind of big girl decision was taking my full ride scholarship at Arizona State instead of going into major debt, going to a fancy school that I got into that I won't say the name of. And it was hard, but at some point, it was actually just a few weeks before school started, I changed my whole college admission plan and scrambled for that. But I realized, what was making me go to this fancy school. And it was really probably my ego, right? And I realized that at my state school, I would have plenty of opportunities, but also not have that debt. And I knew I wanted to go on to medical school or some sort of graduate school after college. And I didn't want to face this insurmountable debt when I got through. So that was kind of a first good decision that I think I made. I went from 98 to 2002, graduated summa cum laude with a BS in political science and a BS in microbiology, and went to the Barrett's Honors College. So I mentioned the degrees just because you don't have to do, a super sciencey background. I mean, most of my coursework was really in the poli-sci area. And I think it was totally fine. People want to see what you're interested in, and college is a perfect time to take those classes that you just want to know about. You don't have to focus everything on medicine. I did tons of extracurriculars and an honors thesis. And my honors thesis really started kind of this interest that I have had throughout my whole career so far in terms of healthcare access and healthcare empowerment. So raising awareness for various demographics in healthcare and the challenges that we face to deliver healthcare to people, whether that's access in terms of physical location or access in terms of information. This is something that has been an interest of mine throughout. And I'm glad that I kind of got a chance to start that off in college. So
Dr.
I would,
Collins,
yes.
sorry, I apologize. We love hearing all the insights, but I think your slides aren't advancing.
Oh, shoot.
We're still
Oh,
left
no.
on the first slide that you showed.
Oh,
us, which is
no.
the
I wonder how I can get it to fix it. What was wrong with this thing?
I think, Dr. Collins, the best way is that you could just go regularly like this.
You'll be able to see it like this?
Yes.
Okay.
I think it works best that way.
Okay. Let's see. Sorry about that. So, okay. Well, I'll just start from here still. So, I was super indecisive about what to do after college, but I kept going back to this idea of helping people. And I think that was sort of the driving force behind going to medical school and really behind everything else that's happened since then. I will say, I think a lot of times people ask me, well, how did you get that scholarship to medical school? How did you get into dermatology at Harvard? How did you do it? And I think in a lot of ways, I did it sort of by not focusing on what it was going to take to do that exact thing. I think passion is important. I think trying to make better wherever you are is important. You don't have to center your whole life around a specific goal, like becoming a dermatologist. What you want to do is just, try to make everywhere that you are a little bit better, and let the passions that you have, the knowledge and self-awareness that you have, percolate into all the things that you're doing. It doesn't have to be relevant to the final course. Even like the college extracurriculars, showing leadership, showing service, showing a care in the community, those don't have to be medical related. So I would just broaden your extracurriculars and feel free to do things that truly just interest you just because you want to. There's many ways to demonstrate what a great doctor you could be. So you want to highlight what makes you, you, and also apply broadly. So when you apply to medical school, like I said, apply broadly, highlight your unique personality and passions. And that's what we're kind of like talking about this whole time. You've got to do the work, right? You've got to take the time to get the scores. This will never change, especially if you want to do dermatology. It's probably the most competitive specialty to get into. And so at the end of the day, you've got to take that time just to get the scores, to get the grades, take the time that you need, whether it's a tutor or a study program, whatever it takes to get you in a good position in order to succeed. So this is something that wasn't so much a thing when I was an applicant, but certainly is now. And as I've participated in admissions work and things like that, remember always that anything online is part of your application. And anyone you meet in the interview process could actually be interviewing you. So this is a big social media thing. Social media is not bad. I actually really use my social media as a platform to educate people about dermatology and about women's health and empowerment. But certain things probably shouldn't be on social media during an application process. Drinking a big straight out of a vodka bottle, something like that. It's common sense, you would think, but then some people do get like kind of messed up with that. If your email is kind of inappropriate, let's say it's like, anarchy 41 or something, those sorts of things could be like the tiniest thing that just separates one person from another. I would just, overly political things on social media, as well as like inappropriate situations. This isn't like a med bikini thing. You're walking, you can have pictures of your beach vacation. It's not like that, but I think it's more just what kind of person are you projecting through your social media? Is that what you want to project to the admissions committee? Because you can assume that they're going to look at it. Another thing, when you do interview, a lot of people, hopefully you're not, I'm sure you're all nice people and you're going to be nice to everybody, but what you may not realize is that student that met you, that took you to coffee, or that student that walked you from place to place at campus, they could actually be on the admissions committee and they could have a big say in whether or not you're admitted. So treat every opportunity when you are speaking with or communicating with, emailing with, on Zoom with, whatever the case may be, with representatives from these institutions. Take it as an opportunity to put your best foot forward. So after college, I went to Vanderbilt Medical School. I was there from 2003 to 2007. I was awarded the Canby Robinson Award during the admissions process. So I got this amazing call during the whole admissions interview, scale for medical school, that I had received a full ride merit scholarship for medical school, which is obviously something that you never expect to happen, and was a huge relief and surprise. So I get there all excited and feeling all good about myself, and proceed on to flunk my first examination, like hardcore flunk. And I really was, the wheels were off the cart. I felt very overwhelmed. I felt, I was forgetting to pay my electric bill. I was totally frazzled. I was like losing stuff everywhere, and I was not doing well. And I did something that is my kind of like first big tip for you guys, which is when you're in over your head, sometimes we feel like the courageous thing is to sit in our room and cry by ourselves and, not involve anyone else. But actually, the really, really courageous thing is when you're in over your head to ask somebody for help. So I did that. I went into the Dean of Students office, which I'm not a big asker for help. So it's kind of outside of my normal personality. But I'm thankful that I did, because I think deep down I knew I was at a big crossroads, and that I could either get figured out, get myself on the right track, or I was going to have to, just let it all go. So I let the Dean of Students know that, I was in over my head. I didn't know how to crawl out of the hole. I felt totally overwhelmed. She sent me over to the school psychiatrist. Okay. I'd never seen a psychiatrist in my life, or nor had I considered doing that. And after, 3 hours of interviews and discussions, she had informed me that I had like decompensated ADHD that I'd had my whole life, and, had just functioned so well by my great memory and just being able to just memorize things better than the average person, that I have been able to just kind of coast through, but now I can no longer do that. So I learned to reorganize my brain, and took some time to really understand that and work around how I could become more organized in my brain, and went on to graduate for valedictorian of my med school class. So I know things felt pretty dire in the beginning there. I felt like I didn't belong. I felt like they should have given this scholarship to someone else, which is what I told the Dean of Students. But I was wrong. I needed some help. So if you ever feel like you're at that crossroads, really bad place, it's not going to happen every day. It's not going to happen very often, but those few times in life where you're really at a turning point or a fork in the road, ask somebody for help. Again, lots of extracurriculars in med school. Most importantly, in the kind of the best experience of my life, really, other than having my child, was founding a student-run free clinic, which continues to see thousands of patients a year. Again, I was really interested in health awareness and in health access and empowering people through healthcare. And I also wanted to empower students because I noticed the first and second year, we were just like on the grind in the books and never getting to see patients, and you sort of like lose sight of why you're there in a way. So I saw this opportunity to empower students and at the same time empower a community that desperately needed healthcare. And it worked. And a couple years into the project, we opened, me and my friend that we started the clinic together, we opened Shade Tree Family Clinic. And of course, as you know, any knowledge of me would show, indecision strikes again. I had no idea what I wanted to do after medical school. Get called in by the dean of the medical school this time that I'm the only one that hasn't made any sort of decision, and I got to pick something for the match. And I had filled out an application for plastic surgery thinking, oh, I really like surgery. I think I will do plastic surgery, but I just felt really unsettled about it. And a boyfriend at the time, so he was a really crappy boyfriend, so the relationship didn't last, but the advice was good. So I still think of him fondly for that. He recommended I check out dermatology and specifically Mohs surgery. He said, you've got the grades to do it, you've got the ability to do it, and you're going to get to do these procedures and surgeries while still having this work-life balance and be able to pursue other interests, which has always been something that I've wanted to do. I've never been that person that wants to like sit in the hospital all the time and that's the only thing that they have. I totally respect the people that are like that have that one track mind. But I don't. I like to have eggs in every basket and do a lot of different things. So I did a rotation, kind of snuck one in dermatology and Mohs surgery right before applications were due. And then the week they were due for the match, I switched everything from plastic surgery, switched to my application to dermatology. You might be wondering why I have a Halloween picture here for you guys from medical school. It's because the applications for the match that year were due on the Halloween by midnight. So I was sitting there on the computer in my angel costume, just typing away, trying to explain why I wanted to be a dermatologist. And that was down. I think I submitted it like 5 minutes till it was due, but it all worked out, right? And again, the whole point is let passion be your guide. I hadn't done anything relevant to dermatology when I was accepted into dermatology. I didn't even know I wanted to be a dermatologist. I didn't even know what Mohs surgery was until a couple weeks before the application was due. So, but what I was able to show them was that I had a lot of passion. I want to help people. I want to serve the community, and I want to empower other people. And that is relevant to any career choice. So don't feel like, if you do know what you want to do and you go for it and you go straight on a straight dive in, that's cool too. But if you don't, it doesn't mean that you can't do it. I think a lot of people think dermatology is the thing where you had to know, like, since you were, in utero, that you wanted to be a dermatologist. And I'm here to say that's not true. You can get there a lot of different ways. So why did I like derm in that last final decision? I loved procedures. I love instant gratification, guys. I'm an instant gratification person. I love the fact that someone is going to come to me in a day and they've got a problem and I'm going to solve it that day is something that I really like. And it's so that's truly relevant for my Mohs surgery. I like fast-paced work. I'm running around all day with different things in different rooms so I don't get bored. And of course, the work-life balance. You can't talk about dermatology without talking about work-life balance. I think that's why a lot of people gravitate towards it. And that's why one of the reasons I did, I wanted that freedom to be able to pursue other interests and have other things to do. So my pro tips for your rotations in medical school to help you kind of be the dermatology future resident of their dreams. Always find ways to help. Make the resident or attending doctor's lives easier. If you see them hunched over paperwork and you know that then they have to go check on a patient, jump in and say, hey, can I finish filling that out for you so that we can divvy this up? they are not going to necessarily assign things to you because they don't know what you're capable of, and they really don't know what to do with you until you just insert yourself. You want to hear at the end of every rotation, you want to hear the words, I don't know what we're going to do without you, because you've inserted yourself into the team and found ways to help them. If you know they need to call some patients back, hey, can I make those phone calls for you while you do XYZ? They will be so happy. And I promise you, you'll get more out of the rotation by taking that like active learning perspective. Show up early, leave late, guys. That's like the oldest story of the book, right? Any job, if you want to do good, be the first one there. So it's true there as it isn't anywhere. Always, and this is my recommendation for the rest of your life, and any conflict, conflicts are going to arise even among totally reasonable people at work or in training programs. If you always have the perspective of the patient at heart, you can always have a good discourse, and you can always reach compromise. If both people are putting the patient first, there is nothing you can't do. Whenever I was on a rotation, I thought about ways I could help the patients. When I was in medical school, that Hurricane Katrina happened, and I happened to be on an inpatient medicine rotation. And I just was so touched by all of these patients. A lot of them had, neurologic problems. They didn't know where they were from. They didn't know what their number was. They didn't know what their family's numbers were. They were completely displaced and disoriented. So I went on just a deep search trying to find people's families. I stayed there late. I stayed there for days trying to find people and connect them back to their families. And there's experiences like that you'll have that you will remember for the rest of your life, but only if you seek them out and you do it. So I definitely would always just keep it in your head that you're there for the patient. Extracurriculars are key in medical school, just like college, in terms of making yourself a competitive match candidate. All schools and all programs in every step of the way are trying to find people that are going to make their community better. So how have you helped the community you're currently in? Do your extracurricular activities show leadership, service, and most importantly, demonstrate who you are? That's what you want to see, because there's this like pile of applicants with good scores and good, grades and good this and good that, and they seem really nice, and they are really nice. And so, what makes you unique is you, and nobody else can replicate that. So, important tip for success that's helped me. I think I've mentioned a couple times now, I'm a little indecisive, guys. I have trouble making decisions. And part of it is because I'm so like positive thinking that I tend to think, oh, well, I'll like that. I like that. That sounds good too. And I'll think, oh yeah, that'd be okay. But I've learned over time to figure out what annoys me the most and avoid that at all costs. Sometimes it's easier to figure out what you don't like than it is to figure out what you do like in a lot of ways. Things I knew I did not like, dark rooms, no radiology for me. I did not want to be in the basement, being alone. I'm not like a loner at all. Didn't want to deliver a ton of bad news. There were some things I considered like neurosurgery that were really cool and really exciting and interesting. But when I really imagine myself having to deliver the type of news that they deliver every day, I knew it probably wasn't for me, because I would tend to take that home with me. Didn't like sick little kids. That was like a little too much for me emotionally. And I didn't like a lack of continuity. Like I didn't want to be in the ER trauma where I was never going to see people again. So I always recommend for med students and pre-health and everybody to imagine doing the job you're considering 20 years after you've been doing it, and after you've done the procedure or the typical day thousands of times. And do you think you'll still like it then? Because there's this tendency, I think, for adventure seekers or like me to just gravitate towards the thing that's like the most exciting at first. I want to be a heart transplant for children or something. And because you love that excitement, but then you have to realize that after you've done a certain thing thousands of times, you're not going to have that excitement anymore. What you really have to have is just that love for that typical day. So after med school, I did my internship at University of Tennessee at Chattanooga, staying near the boyfriend, the ill-fated romance that I told you about. And I picked a transitional year intern, which means you get to rotate through many different inpatient, outpatient departments in the hospital. I really liked that. It was awesome. I strongly recommend transitional intern before dermatology, unless if you are worried that you might not match in dermatology, which, you will have some idea if you're a really strong candidate or if you're not, then you may want to do an intern year that quote unquote counts for something else. So like an internal medicine intern year, where if you didn't match again, you could continue on with internal medicine. That year wouldn't just be like a wasted year. Transitional intern year doesn't really count for anything else other than these specific like radiology, ophthalmology, dermatology, and certain things that you can do a transitional year in front of. So if there's any question you're worried about the match, then you may want to go ahead and do that internal medicine internal medicine intern year as opposed to transitional. So then I went on to my residency in dermatology, 2008, 2011, did the Harvard combined residency. So we covered a lot of different really cool hospitals based out of Mass General, but went to all of the different Harvard hospitals. And it was like taking a really nice long sip of water from a fire hose. There is a ton of information to learn in dermatology. I didn't realize how rigorous it was really going to be. And it just really is, but it was exciting. Really a time of personal growth, showing up, in my apartment, not having any furniture, buying stuff from IKEA, getting delivered a month later, realizing I have to put it all together. So sleeping on like a pile of clothes for a month or two, stuff like that, not knowing anyone, it's just was a great period of growth, both intellectually, but also just personally as well. And I think residency does that for a lot of people. Learning tip, which I learned in residency and I still do to this day, is to always associate knowledge with a specific patient or clinical case. And I still do this even now. If I see a patient with a certain condition right after clinic, I just take a quick look and read a little article about that. And in my mind, I've been able to link that patient and that condition, and it's so much easier to remember things. So in residency, after clinics and after seeing people in the hospital, I would always just sit down for, it doesn't have to be super long, but like even 30 minutes just with the notes of what I saw and just read right there, the little piece of the chapter, the little article, to kind of link in your brain that patient with that information. Pro tip for rotations, for residency and for life in general, treat every situation as an opportunity. I was in my second year of residency and I was doing my surgery rotation. And at the end of that rotation, the Harvard Department of Mohs Surgery Procedural Dermatology offered to withdraw from the match for the next year and give me the spot. So, I could have just been going to rotation. You never know when you're just going to rotation or when you're interviewing for a prestigious fellowship spot and highly coveted fellowship spot. It was a very big blessing. And I would just recommend to always come into your learning opportunities with that eyes open kind of perspective and that gratitude, humbleness, and just taking everything in to the best that you can, being the best that you can on those rotations, because you never know when that one day in residency is going to be a big door that opens for you. So I did my fellowship, stayed at Harvard for that, 2011 to 2012. It was an ACGME accredited procedural dermatology fellowship, which included Mohs micrographic surgery, surgical dermatology, dermatologic oncology, and cosmetic procedural dermatology. So kind of like covers the basis of all the surgical aspects of dermatology. I finally got to wear scrubs every day, which I'm still wearing right now. And I love that. So I don't have to decide what to wear. And hilarious side note, I bought a pair of Dansko clogs right before I started my fellowship year at like half off. And I've been wearing that same pair of clogs to work every day since then. I don't know how they're still even intact, but I love, and I'm like emotionally attached. Like they're like my service animal. So just to recoup, let's see, I went to my Mohs fellowship. Right after Mohs fellowship, I took a job in a large private practice in the New England area. I kind of went where the cases were. I realized that after training, the number one thing I wanted to do was hone my skills. So I found a job where I would do nothing but Mohs surgery, surgical dermatology, and cosmetic dermatology, no derm clinic. And I did that, so that I could feel after a couple of years, I was super confident and just ready for anything. After that, I moved to Austin, Texas. I was recruited to a large practice here and continued to see just thousands of patients a year for surgical dermatology. I worked in this private practice for several years when they were acquired by PE, private equity, which a lot of you guys might, I don't know if you might or might not know that a lot of private practices are being acquired by private equity, but I didn't like the private equity model. It wasn't for me, and I didn't think it was great for patient care. So I decided to move on and start my own practice, and had my last day at that group practice on December 31st, 2019. Happy New Year to me, getting out of there. And then started my practice with my friend, Austin Skin, in our rural location in February 2020. So this is us all excited to sign on the dotted line for our loan. Building space and all that stuff was great. And still, carrying in that passion for access to healthcare. Our first location of our practice, we put in rural Texas, about 45 minutes outside of Austin, in a very healthcare underserved location where we knew we could provide a lot of benefit to people and really help a lot of people with advanced dermatologic conditions. So it's been academic, it's been challenging, it's been rigorous, but it's also been really, really rewarding to be out in that location. And then, of course, you might have noticed that I started my practice in February 2020, about a month before the pandemic. So that was just one of those things you just could never predict in life, that you were about to start a practice in the middle of right before a major global event. But we were able to sail through, we were able to make it work. And we have been delighted to be able to practice, to be able to open another practice in a boutique location in Austin, Texas, have been voted among the best of the best in dermatologists in Austin, and received a Rising Star Award for a new business in our rural location town. So let's start talking about my day as a procedural dermatologist. Skin cancer is, by far my bread and butter. It's kind of what I do day in and day out. I've treated probably about 12 or 13,000 skin cancers with Mohs micrographic surgery in my career so far. So there's a lot of skin cancers up in here. Skin cancer is the most common of all types of malignancies and affects people of all ages. So you can really see a huge range of patients. I use Mohs micrographic surgery to remove skin cancers, and I do reconstruction of defects from the tumor removals myself. I also do excision surgery for melanoma, other skin cancers, and benign tumors and growths. I manage patients with high-risk tumors or very high risk of skin cancer. And I do laser and device procedures. I also do cosmetic procedures, including fillers, neurotoxin, sclerotherapy, blepharoplasty, liposuction, and threads. So here are some pictures of a Mohs micrographic surgery experience. You can see me on the top left, just kind of chilling with my multiple coffees and snacks, looking at my slides. Basically with Mohs micrographic surgery, I remove the tumor, I bring it back to my lab where you can see right here, I've got my histotech creating slides. We do frozen sections and I look at 100% of the margins on path. I then remove more anywhere I need to continue to remove the tumor, but also be as tissue sparing as possible. And here I am wearing my little headlamp so I can see better, which makes me look kind of like I'm going to a rave or something. And then I get to do the surgical part of the reconstruction. So it's all really exciting. Up here in the upper right is my daughter hanging out with me at work. I always love it when she comes to visit work. Here's an example of what I see under the microscope. So on the left, you can see just a regular nodular basal cell carcinoma. That's like the most common form of skin cancer there is. And then on the right, you're going to see a more aggressive, it's a poorly differentiated squamous cell carcinoma that's actually infiltrating a large nerve. So I had to follow that tumor out along the nerve in order to remove the tumor for the patient. So I do a lot of flaps and grafts and basically reconstructive procedures. So you can see here, that's just a linear Mohs repair in 2 weeks. You can't really see the scar. This was one of the little one on the nose from a basal cell carcinoma. Did a flap for that, and then a couple of views. And you can see in 2 weeks, there's really hardly any visible scarring there. So we're able to obtain excellent cosmetic procedural results for the patient because this is, pretty much all we do. So here's another example of just a Mohs case, a gal with squamous cell carcinoma of the lip. And you can see the defect from the Mohs procedure, and then the flap that I did. And I also did extend the whole flap across the lip to elevate her lip as a little bit of a cosmetic twist for her that would make her lip look less elongated there. And then you can see her in her picture back in just 2 weeks. That scar will continue to heal and look better over the course of the year. So she's destined to have an excellent cosmetic result. In terms of laser procedures, I have a ton of different laser procedures I do here for cosmetic and non-cosmetic purposes. Here I am doing a radio frequency microneedling on my dad, who's doing the air guitar. And another just video of a laser procedure for you guys. In terms of cosmetic procedures, here's a procedure called threads, where I use these essentially barbed sutures and unbarbed sutures under the surface, some of them coated with something called Sculptra, to lift the skin and give them kind of like a non-surgical lifting procedure. Here is me performing just some Botox Neurotoxin for a patient. This relaxes the muscle to relax wrinkles and lines. And everybody's super into lips right now, right? So everybody likes their lips injected. So that's just a lip injection procedure for one of my other patients. Here you can see this patient is a little bit older, but cosmetic patients run the full gamut of age from early 20s to, really any age. I have patients that are 85 that like to have cosmetic procedures. So it's something we can do to keep people looking beautiful and also natural throughout any phase of life. In the middle here, I'm doing something called an aqua gold microneedling PRP procedure. So I actually get PRP from the patient's blood. I mix it with some neurotoxin and fillers, and I use that to kind of microneedle into the skin with these gold hollow needles. And then here I'm doing some filler on the cheeks to just kind of augment and lift this beautiful patient's cheeks for her. And then a non-surgical nose augmentation. So you can see on the picture right next door what the nose looked like. It actually looks like she had a nose job, but she didn't. She just had some injectable filler. So it's really exciting, some of the things you can do just to actually completely change even the face. So this is kind of a fun video showing some leg vein treatments. I'll devein you faster than a bowl of shrimp. The Rachel Ray of legs. So it's kind of fun to watch the veins just disappear. It's one of those rewarding procedures that everyone sort of likes. And one nice thing about dermatology is a lot of my patients are in here smiling, laughing. They are pumped to be at the doctor. There's not a lot of medical careers where people are just really excited to be at the doctor's office, but this is definitely one of those. Here you can see just what, some filler and neurotoxin can do to augment someone's beauty. She's a beautiful girl, beautiful woman, but on the right side, you can see she just has some tear trough abnormality and some flattening of the cheek, laxity, and some just gravitational pull downwards. So we just brightened her right up using hyaluronic acid fillers and neurotoxin. And this is a view from the side. She's the same, right? She's the same beautiful woman, but just looks more like what she feels like she should see when she looks in the mirror. Looks less tired, looks awake, looks gorgeous. This is another example on the bottom right of just a non-surgical filler and neurotoxin in facial improvement, facial optimization for a patient. So one thing I love about dermatology, in addition to all the fun surgical stuff and the Mohs and skin cancer, is this moment. I get to see this all day, every day. People brightening up when they look in the mirror, feeling confident, giving me hugs, and whatever they're doing in their life, giving them that extra boost sometimes that they need to get it done. So I feel like I can be part of their success in a lot of ways. I do a lot of excision procedures, of course. This is a benign excision right here. I'm going to excise a cyst. I know everybody likes that because everybody likes Dr. Pimple Popper, who's lovely, by the way. I've hung out with her before, and she was a real sweetheart, very down to earth, and she's done a lot to help put physicians on social media. You know, it's our job as physicians to put information where patients are going to look for it, right? Like 90% of people look for medical information on social media. It blows my mind that people are getting their medical information from the gram, but that's what they're doing. So we've got to be there. We've got a duty to be there and to fight some of the misinformation that happens if we're not. So I'm just stitching that cyst up. Hopefully you guys saw the really gross contents in there. Over here, I'm just doing actually a non-cosmetic blepharoplasty. I'm doing a blepharoplasty because the patient had such excess skin. His eyelids were really just drooping over his field of vision. So we decided to do blepharoplasty. Here you can see in this bottom picture how much skin was actually extra that we removed from that eyelid. So he gets to be a new man and can actually see and can do the work that he's doing at his ranch. So in this video, I'm excised a melanoma from a lovely patient who was in her 30s, a young mom. She had an invasive melanoma that my partner diagnosed. And I'm just suturing it with deep dermal sutures right now. And this is another common procedure at the office. And melanoma excisions and repairs are super, super rewarding because, as you know, melanoma is a potentially deadly skin cancer and can affect young people. So it's one of those things that we want to catch early. And it's such a blessing when we catch it early enough that we can just remove it in the office and give that patient that peace of mind that they're going to be okay. So now I'm done my deep dermal sutures. And then I just follow that up with some top sutures and the patient's good to go. So other stuff that's part of my job, the good, the bad, and the ugly, some fun things I get to do that I enjoy doing. I sometimes appear on things like the news or in blogs or on, I'm a guest expert on articles about skin related, dermatology related, and women's health related subjects. I get to sample a wide variety of skincare products. Sometimes I feel like I'm not working because I'm putting all these like masks and things on my skin. And it feels like I have access to like a never ending Sephora, but better. So that's kind of great. And then of course, the bad and ugly is, of course, the paperwork. There is no career in medicine that does not have paperwork. I'm pretty sure I've read a study that dermatology has less paperwork than a lot of them, which is, I can't even believe that because it seems like there's so much, but any career in medicine, you're going to have the paperwork. So there I am with my computer, just in my blue light protective glasses, trying to make the best of it. Another thing I love about dermatology, which I mentioned earlier, I didn't like things without a continuity of care. Even with skin cancer, patients that get skin cancer a lot of times, unfortunately, they're repeat customers. They have damage of their skin, they have genetic risk of skin cancer, and you might see them a few more times, you might see them many more times. I get to know my patients. My patients are under local anesthesia during their procedures. So we talk about what their thoughts are on life, love, and everything in between. I know their life histories. They know me as well as some of them probably know their grandkids. So it's one of the most rewarding parts of my job is having that really intimate relationship with my patients. So other dermatology careers, right? Most people aren't procedural dermatologists that are in dermatology. There's so many potential avenues you can go in dermatology. The skin is the largest organ in the body, and it's affected by more than 3,000 diseases or conditions. And that's more than any other organ system. So back when I told you guys that the residency was like drinking water from a fire hose. This is why there's just so much information. There's so many diseases. Dermatologists treat an incredibly wide variety of disease and conditions. So there's no shortage of avenues to take for a dermatology career. Lifelong learning is essential, and you have to really enjoy it to enjoy being a dermatologist. Dermatologic diseases, a lot of them aren't fatal, but many of them profoundly impact a patient's life and well-being. The skin is so important to us. It's our face that we put to the world. And so when something is wrong with our skin, it can be deeply, deeply disturbing. The skin also serves as a window to our overall health. Here in the dermatology office, we might make a diagnosis of a skin condition that makes us know that the patient has a risk for internal cancer or has an internal cancer. There's so many things the skin tells us about the general health of the body. So that's kind of exciting to be part of putting that puzzle together for the patient. The diagnoses are largely clinical, which I love. It means, you're not necessarily in a long interview with the patient. You don't have to dive into with all these, labs and explorations to try to figure out what's going on with the patient. A lot of times you're going to be just using your eyes, which is such a really powerful and cool feeling to be able to do for someone. The day is busy, it's varied, and it's often unpredictable, but it's usually 4 days a week. So it's usually going to be in the Monday through Friday. So that's one benefit for dermatology as opposed to other medical careers. There's many types of dermatologists. There's medical dermatologists that might specialize in a number of different types of disorders. There's pediatric dermatologists that could do a fellowship after dermatology residency, cosmetic dermatologists like me or procedural dermatologists, inpatient dermatologists. And if you decided last minute that you were one of those dark room people and you wanted to be a basement person, there's still hope you could go into dermatopathology as a fellowship option. Other considerations you have to make would be, do you want to be academic or private practice? Do you want to be corporate or large group versus practice ownership? Those are all things you would learn about yourself with time. And there's potential positives and negatives for each one. I think dermatology is an amazing career option for the future. If there were any potential negatives that I would say, it would be thinking about what's the role of private equity going to be in healthcare, and what's the role of mid-level providers going to be in healthcare? Are they, is there going to be enough of a role for physicians? I think so, but these are some of the things that are affecting kind of the overall healthcare system right now, and particularly dermatology. So, secrets to the happy life and career. I promised you guys to give you guys everything you needed to know to be a happy, successful person. And here, we've already covered a lot of ground, but here's my tops in the next 2 slides. Whether in business or life in general, it's all about relationships. One of my biggest opportunities that I told you guys about happened on a normal rotation. That was getting my fellowship. And I have built my career with my co-residents and besties. So sometimes that time you spend just getting lunch together, talking about what's going on in your lives with your co-residents, taking that time for those social interactions can actually end up being the things that make your whole life. Very few careers occur in a vacuum, and nor would you want them to, right? You never know when the relationship you're cultivating will one day be your business partner, the source of your aha idea, the source of mentorship or opportunity when you need it most, or just provide that enjoyment that we all need for our lives. Relationships are always worth your time. In fact, they're the entire point. So if you want to go fast, go alone. If you want to go far, go with others. I really like that proverb. And then my other ultra secret key to a happy life is to know yourself, identify your purpose. Your purpose should easily fit into one statement. For example, for me, I think my purpose is to help empower others. Imagine if your life was made into a book. That book should read like a how to accomplish that purpose. Your work absolutely needs to coincide with your purpose. Authenticity is everything in terms of what you can achieve in life. It's also everything in terms of your own inner happiness. You're going to use those authentic feelings to decide what kind of practice you should go into. Like in dermatology, you might think about, do I want to help others through a truly difficult time or a life-threatening situation? Or do I want to help make people feel beautiful? That would help you know what area of dermatology you might be most interested in. As I said, I see my life purpose as empowering others. It kind of always has been and always will be. At times, it might have been through raising awareness to issues affecting certain individuals, or improving access to healthcare, or improving an educational experience for other students, or making people feel confident. But always the theme is serving others through helping to empower them. And when you have that as your core and you have something that's driving everything that you're doing, I really believe that that's where true happiness and true success comes from. Money is not a purpose, and decisions based on money lead straight to unhappiness. I will take that to my grave. Money is never a purpose. I love this Gandhi quote that says, happiness is when you think what you say and what is when what you think, what you say, and what you do are in harmony. And I completely agree with that. So what's next for me? I've actually been working for the last several years on my own skincare line, which is coming out for national retail in November. I'm super excited about it. I see the beauty industry as having huge problems. I think that we need to make the beauty industry empowering for women and for all people. And so I'm making this new skincare line, which is based on mindfulness, on self-love, appreciation, acceptance. Each skincare product is paired with a mantra and an emblematic kind of bird and a meditation. So just to help people bring a few minutes of mindfulness and positivity into their daily life through their self-care routine. Here's a picture of me doing something that I love, which is surgery. And of course, a couple pictures of my fam. That's my daughter, Maya, and my husband, Matt. I'm forever grateful to the universe for all of my good luck. And I hope there's a few things that have helped you guys maybe learn about dermatology today. If there's any questions, I'm happy to take them now.
Thank you so much, Dr. Collins. That was such an amazing presentation. I think a lot of our attendees really enjoyed that. It was like a shadowing session also. So thank you for that. If you kindly stop sharing the screen for the slides, and we'll head right into our Q&A session. So for our first question, what were your extracurriculars or clinical work during undergrad and medical school?
Yeah, so undergrad, I did a lot of student government. So I was really, really involved in the student government. I was also really involved in my sorority. I was president of that and did a lot of service projects. I worked for free at a sexually transmitted disease clinic. And then I think, one of my big things was that honors thesis and the research that went towards that. So it was a big research project where it was survey research. And I basically was looking at, among different demographic variables, what affected heart disease awareness. So thinking about whether African-American people, whether women were less likely to have those fundamental pieces of knowledge in order to prevent or early recognize heart disease. So those were some of the main things that I was into in undergrad. In medical school, I was involved in a lot of different clubs, like diversity club, and took leadership roles in different clubs. But really my biggest thing was that free clinic. It took a couple years to found, and it's still there today. I was honored in February 2020, right before the pandemic. I was brought back to the medical school. They had a huge banquet and everything. And it's now every year it's been voted by the students exiting the school, the number one thing that they loved about their medical education. So that was just a huge thing for me, and it took a lot of time, but it was very worth it.
Thank you so much, Dr. Collins. Kind of in relation to diversity, we have an anonymous question. What suggestions could you give for students of color who are interested in entering dermatology?
So I love that question because I actually think that I think there's been a lot of problems with dermatology as a field and diversity. I actually am part of a diversity in dermatology group on Facebook that's really, really cool. So if the anonymous person would ever want to be connected there, they could always message me on Instagram. It's important in every career, in every aspect of medicine to have diversity, true diversity. And patients, we know they need to see representation in their doctors. But there are really, really amazing dermatologists working on that all the time. And it's something that I know a lot of us are really passionate about. So I'd be happy to connect anyone that messages me with the people who are most active in helping to make sure that we will have representation by people of color in our field of dermatology.
Awesome. Thank you, Dr. Collins. And the next question is, did you hold a job during medical school?
No, in my medical school, I did hold a job in college. I always had like 4 jobs and they were always really embarrassing. But in medical school, we were not actually able to have a job. It's not allowed. And there's really no opportunity. It was like 80 to 100 hours a week, honestly. They didn't even have the work hour restrictions then. So there was no time even for sleep. So no, but I don't know of anyone who did. In residency, sometimes there's some opportunities to what's called moonlight, where you can kind of work on the side. Some residencies forbid that and some years forbid that, but occasionally you can find those opportunities then. But for the most part, in medical school and residency, you probably won't have the opportunity to work outside of school.
All right. And the next question is, how competitive is the dermatological field?
So, it is really competitive. I have to be honest. It's probably the number one most competitive residency to get into right now, at least maybe in the top 3, if not number 1. A lot of people want to do it. The best thing you can do is just really be true to yourself, like I was saying, and try to spend your time wisely, pursuing interests that are important to you, and also just showcase what kind of person you are. And then, you will have to get the scores and you will have to get the grades.
Right. Mm-hmm. And do you work closely with oncology?
Yes, so I do. When we have skin cancer patients that have invasive cancers that are maybe in the lymph nodes, they've metastasized, they're at threat of metastasizing, then at that point we work in a team with oncologists, radiation oncologists, whoever, geneticists, whoever may be necessary in order to provide that care for the patient.
Awesome. And is it possible to be in the dermatology career without having to perform surgery?
Absolutely. Yeah. Actually, a lot of my most people that go into dermatology don't do a fellowship. They do medical dermatology and they do clinic, 4 days a week. And with dermatopathology, you're reading slides all the time. So you can also do clinic too, but that would be a really less hands-on. Pediatric dermatology generally does not have procedures too much. They might have a biopsy or something, but not like a surgical procedure. And then in terms of general dermatologists, one of my partner that I founded the clinic with, she does some little excisions herself and then sends the rest of the stuff to me. My other partner that's coming does not prefer to do any excision surgeries or surgical procedures. So those she would send to me. So you can always pick what type of patient that you are comfortable seeing or what kind of care you're comfortable providing.
Awesome. And I have a question. What advice could you give for shadowing?
Shadowing, sometimes the best bet is to just kind of reach out to some local people and ask them. I know I've had a couple students come shadow me this summer that just they emailed me. Otherwise, I wouldn't have known about them. You can also certainly reach out to if there's a local medical school or something, but sometimes that's hard because they're trying to deal with all their residents and their medical students. They might not really be ready to host college students or something like that. So I think sometimes just reaching out to people through emailing an office that you have some respect for is the best way.
I agree. And I actually had a question, Dr. Collins. What are your thoughts about skincare facial masks? Is there one that's more effective than the other? The clay, charcoal?
Gosh, it kind of depends on what you're trying to treat, right? So, depending on what sort of skin conditions someone has, if they want to do hydration and anti aging, or if they're having acne, they're going to have different things that are more effective for them. Masks overall aren't necessarily like therapeutic clinically, but they might make your skin seem like it glows more, like makeup glides on more easily afterwards. I think it's more for the feel of it, than anything. In terms of, real clinical efficacy, I would say one thing to do, even from a young age, would be to incorporate a retinol containing product into your nighttime skincare routine. They've shown that over time, over many years, that will actually make a big difference in terms of your aging of your skin.
Awesome. Thank you, Dr. Collins. And one last question. How do you determine which surgeries can be done in your office and others in a hospital setting?
So I do them all in the office, and even like my blepharoplasties, my big flaps, I am able to do them all in the office setting. The only times that I've had to have someone leave the office setting was if it was down into the bone of their skull, for example, then that is obviously going to require anesthesia in an operating room. That's happened it does happen from time to time, unfortunately. If the tumor has invaded into like a deep, bulky muscle, so that makes it very difficult to provide adequate anesthesia under local. That would be another case. So, kind of guided by whether local anesthesia and nerve blocks and things like that will appropriately control someone's pain. Overall, patient is much better off just having local in the office than being under sedation or anesthesia in terms of overall safety. So we can actually do a lot. We can do pretty extensive reconstructive procedures under local as long as we're not in a bulky muscle, like, something like a bicep muscle that is a, big skeletal muscle, not just like a little facial thing, or into bone.
Okay, thank you so much, Dr. Collins. And thank you for sharing with us your time and all the experiences that you showed throughout your PowerPoint.
No problem. Thank you. You guys have a great day. It was so nice talking to you. Don't forget to connect with me on Insta if you have any more questions.